Today's quiz focuses on diuretics, an essential pharmacological class used in managing conditions like hypertension and edema. This quiz features 10 multiple-choice, scenario-based questions designed to challenge your understanding and refine your knowledge of diuretics. Each question offers 5 options, with the correct answer and explanation provided for clarity. For an in-depth review of key concepts on diuretics, check out the companion video linked in the description. So, let's begin. Question 1. Mr. Anderson, a 68-year-old man with chronic heart failure, presents with worsening ankle swelling and shortness of breath on exertion. He is currently taking furosemide 40 mg daily but reports no significant relief. Recent blood work reveals a serum potassium level of 3.2 millimoles per liter, which is below the normal range of 3.5 to 5.0 millimoles per liter. Which of the following mechanisms of action best explains the potassium-lowering effect of furosemide? Option A, inhibition of sodium chloride importers in the distal tubule. Option B, inhibition of the sodium-potassium ATPase pump. Option C, inhibition of sodium-potassium 2 chloride importers in the thick ascending loop of Henle. Option D, blockade of aldosterone receptors in the collecting duct. Option E, stimulation of the renin-angiotensin-aldosterone system. The correct answer is option C, inhibition of sodium-potassium 2 chloride importers in the thick ascending loop of Henle. The explanation is that furosemide is a loop diuretic that inhibits the sodium-potassium 2 chloride importers in the thick ascending limb of the loop of Henle. This leads to decreased reabsorption of sodium, potassium, and chloride, resulting in potassium loss in the urine. This mechanism is responsible for its potent diuretic effect and the associated risk of hypokalemia, as seen in Mr. Anderson. Question 2. Mrs. Smith, a 34-year-old woman in her second trimester of pregnancy, is diagnosed with gestational hypertension. Her physician considers starting a diuretic. Which of the following diuretics is contraindicated in pregnancy due to its potential teratogenic effects? Option A, hydrochlorothiazide. Option B, spironolactone. Option C, amiloride. Option D, chlorthalidone. Option E, furosemide. The correct answer is option B, spironolactone. The explanation is that spironolactone is contraindicated in pregnancy because of its antiandrogenic effects, which can disrupt normal hormonal development in the fetus, potentially causing feminization of male fetuses. Other diuretics like hydrochlorothiazide and furosemide are used cautiously during pregnancy but do not have the same teratogenic potential as spironolactone. Question 3. Miss Jackson, a 12-month-old child with congenital heart disease, presents with fluid overload. The pediatrician prescribes spironolactone. Which of the following adverse effects is most likely to occur in a pediatric patient treated with spironolactone? Option A, hypokalemia. Option B, gynecomastia. Option C, hypernatremia. Option D, nephrotoxicity. Option E, Stevens-Johnson syndrome. The correct answer is option B, gynecomastia. The explanation is that spironolactone is an aldosterone antagonist that can cause gynecomastia due to its antiandrogenic activity. This effect is dose-dependent and more pronounced in individuals with prolonged use. While hypokalemia is less likely with spironolactone due to its potassium-sparing properties, gynecomastia remains a notable side effect, even in pediatric patients. Question 4. Ms. Smith, a 25-year-old woman with primary glaucoma, is prescribed acetazolamide. Which of the following is the primary mechanism of action of acetazolamide in managing her condition? Option A, blocking sodium-potassium chloride importers in the loop of Henle. Option B, inhibiting aldosterone in the collecting duct. Option C, inhibiting carbonic anhydrase in the proximal tubule. Option D, blocking sodium chloride importers in the distal tubule. Option E, increasing the reabsorption of bicarbonate. The correct answer is option C, inhibiting carbonic anhydrase in the proximal tubule. The explanation is that acetazolamide reduces intraocular pressure in glaucoma by inhibiting carbonic anhydrase in the ciliary body of the eye and in the proximal tubule of the kidney. This reduces the production of aqueous humor and leads to mild diuresis.
Its action decreases bicarbonate reabsorption, which further contributes to systemic effects, but its main benefit in glaucoma is reduced fluid accumulation in the eye. Question 5. Mrs. Johnson, a 56-year-old woman with essential hypertension, is prescribed hydrochlorothiazide. After 3 months, she develops hyperglycemia. Which of the following mechanisms best explains this side effect? Option A. Increased renal excretion of glucose. Option B. Direct inhibition of insulin secretion from beta cells. Option C. Increased insulin resistance due to potassium depletion. Option D. Stimulation of gluconeogenesis by the liver. Option E. Direct stimulation of glucagon release. The correct answer is option C. Increased insulin resistance due to potassium depletion. The explanation is that thiazide diuretics like hydrochlorothiazide can cause hypokalemia, which impairs insulin secretion and increases peripheral insulin resistance. This mechanism leads to reduced glucose uptake by cells and consequent hyperglycemia. While other options might theoretically contribute to glucose dysregulation, potassium depletion is the most well-recognized factor in this context. Question 6. Miss Evans, a 30-year-old woman, presents with refractory ascites secondary to liver cirrhosis. She is started on a combination of spironolactone and furosemide. All the following are advantages of combining these two drugs except: Option A. Prevents hypokalemia caused by loop diuretics. Option B. Improves natriuresis by acting at different sites in the nephron. Option C. Reduces the risk of gynecomastia associated with spironolactone. Option D. Provides better control of fluid overload than monotherapy. Option E. Allows the use of lower doses of each drug to minimize adverse effects. The correct answer is option C. Reduces the risk of gynecomastia associated with spironolactone. The explanation is that spironolactone is associated with gynecomastia because of its antiandrogenic effects, and combining it with furosemide does not mitigate this risk. The primary advantage of combining these drugs lies in their complementary mechanisms, which prevent hypokalemia and enhance diuresis. This combination also allows lower doses to minimize adverse effects while improving fluid management. However, gynecomastia remains a side effect specific to spironolactone itself. Question 7. Mr. Harris, a 74-year-old man with gout, is prescribed a thiazide diuretic for hypertension. He develops worsening gout symptoms. Which of the following explains the mechanism of this adverse effect? Option A. Increased renal excretion of uric acid. Option B. Competitive inhibition of xanthine oxidase. Option C. Increased reabsorption of uric acid in the proximal tubule. Option D. Impaired renal elimination of xanthine. Option E. Reduced hepatic metabolism of uric acid. The correct answer is option C. Increased reabsorption of uric acid in the proximal tubule. The explanation is that thiazide diuretics reduce renal clearance of uric acid by increasing its reabsorption in the proximal tubule. This mechanism raises serum uric acid levels, precipitating or worsening gout. The other options do not accurately describe the relationship between thiazide diuretics and hyperuricemia. Question 8. Mrs. Brown, a 65-year-old woman with acute pulmonary edema, is administered furosemide intravenously. What is the primary mechanism by which furosemide rapidly improves her symptoms? Option A. Reduces preload through venodilation. Option B. Increases cardiac contractility. Option C. Directly reduces pulmonary vascular resistance. Option D. Blocks sodium reabsorption in the distal tubule. Option E. Enhances cardiac output by reducing afterload. The correct answer is option A. Reduces preload through venodilation. The explanation is that furosemide has a rapid venodilatory effect when administered intravenously, reducing preload and alleviating pulmonary congestion. This action occurs before its diuretic effects take place. While furosemide also inhibits sodium reabsorption in the loop of Henle, this mechanism contributes to its diuretic action rather than the immediate symptom relief seen in acute pulmonary edema. Question 9. Mr. Clark, a 58-year-old man with diabetes mellitus and hypertension, is prescribed amiloride to manage hypokalemia caused by another diuretic.
All the following statements about amiloride are correct except Option A, it is a potassium-sparing diuretic. Option B, it acts by inhibiting sodium channels in the collecting duct. Option C, it is associated with hyperkalemia as a potential side effect.
Option D, it reduces calcium excretion in the urine.
Option E, it is effective in the treatment of Little syndrome.
The correct answer is option D, it reduces calcium excretion in the urine.
The explanation is that amiloride, a potassium-sparing diuretic, does not significantly affect calcium excretion. It works by inhibiting epithelial sodium channels in the collecting duct, thereby preventing potassium loss. This mechanism is beneficial in conditions like Little syndrome but poses a risk of hyperkalemia. The statement about reducing calcium excretion is incorrect, as it is not a characteristic feature of amiloride. Question 10. Mr. Collins, a 60-year-old man, is hospitalized with severe cerebral edema following a traumatic brain injury.
He is started on mannitol therapy. Which of the following is the most important parameter to monitor during treatment with this drug?
Option A, serum potassium levels.
Option B, serum osmolality. Option C, liver function tests. Option D, platelet count. Option E, blood pressure. The correct answer is option B, serum osmolality.
The explanation is that monitoring serum osmolality is crucial during mannitol therapy because its osmotic diuretic effect depends on achieving an appropriate osmotic gradient.
Excessive osmolality can lead to complications such as hypernatremia or acute kidney injury, while inadequate osmolality reduces therapeutic efficacy. Monitoring potassium levels or blood pressure is secondary, as mannitol does not directly influence these parameters in this context. Liver function and platelet count are unrelated to its mechanism of action. Conclusion. That wraps up our revision on diuretics. I hope you found this quiz session engaging and informative. To deepen your knowledge further, consider reading resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. These references will solidify your understanding and enhance your preparation. Also take note that in this video, any mention of guidelines will specifically refer to those outlined in the BNF. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.